I chose the topic how disability impacts more than the individual. I chose to focus on disabilities because this was something that I always found interesting. I like learning about how disability impacts the individual, but also how it impacts a wider variety of people, such as family, caregivers, or friends. I also felt that we just briefly talked about disabilities in class when it came to pain and how many people perceive being disabled as being in pain or having a poor quality of life. So I kind of just wanted to take the conversation in a different direction and expand more on it. So starting with what defines a disability, there are many definitions for disability, but I chose to use the American Disability Act, the ADA, to define what a disabled person is. So disability is someone who has a mental or physical impairment or has a history of an impairment that impedes their ability to participate in life activities or limits their ability. A disability can also be an impairment that is absent or undiagnosed, but is perceived by others, such as society. Examples of these impairments: a mental impairment can be anxiety that is so debilitating that they are actually unable to participate in life activities. A physical impairment can be a birth defect, such as cerebral palsy, which impacts their ability to jump, jog, walk, and do certain things that causes physical limitations. And perceived impairment can be severe burns from injuries such as fire or chemical burns, and it is not actually a disability, but society perceives it to be. So close reading, the primary source, I think I'm okay if that's okay, by Genevieve Fisher. I focused on the line where it states, "My parents, they care, but seem to be scared. They didn't ask for this, they came unprepared." I interpreted this as not a lack of the parents caring, but the fear of the unknown. The parents are unprepared, uneducated, and unfamiliar when it comes to caring for a child with a disability. Most parents don't go into having a child and think, oh, I'm going to have a child that has something wrong with them. And most of the time, these disabilities aren't detected until after they've given birth. So it's not like they're told 4 months in, your child is going to have this disability, and that gives you so over how many months to prepare financially, psychologically, and educationally to give this child the best form of life. So if parents are unable or unfamiliar with caring for a child with a disability, and they give birth and they find out that this child has a disability, they have not set money aside, they have not gone through specialized parenting classes, which kind of puts them in a financial and psychological hole of stressors. So caring for a child with a disability can be financially stressful, as there are high out-of-pocket expenses, and it can also be psychologically stressing because of the many uncertainties. In the poem it states, "As they help us out of a hole so deep." I interpreted this as a financial or emotional hole. This is important because if parents have a child with a disability and they are unprepared in how to care for them, the child will not academically, emotionally, or physically succeed. This can alter family roles and dynamic, which increases the risks of stressors and burdens. Continuing with close reading, focusing on the part of the poem where it states, "We need help from someone who has a clue," or it won't just be me, but the whole family too, what they teach and the people we meet as they help us out of a hole so deep. We can see that the speaker of the poem is basically sending a cry for help. They are seeking for someone who has experience or knowledge when it comes to caring for a disabled child, and asking for them to educate her and her family. I interpreted it as the speaker wanting to learn about how to manage their disability, but also trying to get their parents to learn as well, as she feels that they were unprepared and they don't have a clue. I do feel that this is important because there are many first-time parents with a disabled child, and having a community that you can refer to, confide in, or even just relate to can help parents and individuals manage and live the best life possible. In situations where the parents or caregivers don't have proper tools, such as knowledge or advice, the ones that suffer are not only the individuals with the disability, but also the parents and the families as well. So this is where I kind of broke down and analyzed and annotated the poem. I kind of go into a deeper analysis of the poem within my primary, secondary, and my second secondary source. So I just did want to post this picture in case you wanted to look at it on your own time and see kind of where my thought process was. But I'll skip over this slide and I'll just go into it a bit deeper. So I wanted to at first do an art piece instead of a PowerPoint, but I did feel that I can kind of explain myself better through a PowerPoint, but I still wanted to include something a bit artistic. So on the left, I drew a woman that appears to be in some sort of distress. Around her, I wrote certain lines from the quote from the poem that stood out to me the most. Up above, you see many lines and arrows going in different directions. I wanted this to represent the many different decisions that caregivers or parents of a disabled child have to make on a daily basis. And the colors symbolize different disabilities. Blue symbolizes emotional and psychiatric disabilities. Gold represents neurodiversity. Red is for physical disabilities. And obviously you can't see white due to the white background, but white represents invisible disabilities that are perceived by society. So my secondary source is titled Financial and Psychological Stressors Associated with Caring for Children with Disability. The authors are Anthony, Marie, David, and Dennis. They argue that caregivers who care for those with a disability are more susceptible to financial, emotional, and psychological stressors compared to those who care for a typical child. The methodology for this source, authors use latent class analysis of data from 2010 Ohio Family Health Survey. They used 3 classes of caregivers and collected their responses regarding 15 psychological and financial stressors they may or may not have experienced. Some of the psychological stressors include extents of feeling sad, nervous, restless, fidgety, hopeless, worthless, or that everything is an effort in life. Financial stressors include inability to pay for basic necessities, used most or all of financial savings, have large credit card debt or loans, declared bankruptcy, received financial help when unable to pay bills, or had to have children move in with others. On the left here, these are some of the statistics from my secondary source. 1 in 5 caregivers for children with disability had serious psychological distress, which is 2 times more likely than caregivers for a typical child. 25 to 30% of caregivers had to cut back work hours or stop working entirely to care for their disabled child. Caregivers who have higher out-of-pocket expenses and lower rates of private insurance. Caregivers of a disabled child are disproportionately single or divorced and had an income less than the FPL, which is the federal poverty level. The line from the poem, "As they help us out of a hole so deep," I interpreted this as a financial hole that has continued to deepen as medical expenses pile up without any financial relief. If caregivers are unable to work or maintain normal work hours, this results in a dramatic decrease in their financial income. If they are a single or divorced parent, their sole source of income has now been depleted, as they don't have secondary help from a partner or a spouse, and they have had to stop working entirely or obviously cut down hours to meet the needs of the disabled child. Data does show that low rates of private insurance, which makes it more difficult to pay the higher out-of-pocket expenses to give the disabled child the individual care they need, which can obviously deepen that financial hole or that hole so deep that the poem is referring to. This can also be interpreted as a psychological or mental hole. This article argues that comprehensive care needs of a child with a disability and the family or caregiver's inability to meet those needs can contribute to high levels of stress. Continuous negative emotions or feelings that caregivers feel on a daily basis when trying to meet the needs of an individual can cause them to fall into a deep state of psychological stress. When relating the two sources, I believe that using the secondary source gives a better lens into understanding the poem I Think I'm Okay If That's Okay by Jenny Fisher. Many people who don't care for an individual with a disability may not be aware of the many components that come along with the extensive level of care, and oftentimes our focus is on the individual with a disability and not the caregivers or the families who are stepping into this role. This can result in caregiver burnout and burden. This secondary source allows us to better understand what are some of the financial stressors and psychological stressors that caregivers of a disabled individual face in comparison to caregivers of a typical child. I think even those who have a general idea of these stressors and using the article to understand statistics can kind of help us understand where that poem might be coming from and kind of analyze it a bit deeper. The source allows us to, again, better understand the primary source. It helps us understand why they may need help or what kind of help they are asking for. It also helps allude to the kind of hole that they may be experiencing, whether that be emotional, psychological, or financial, which we briefly talked about. I think that the secondary source also shows that this is a reoccurring problem in families with a disabled child. It gives new parents of a disabled child a look and a window into kind of what kind of changes to expect. The second secondary source, titled Theory, Practice, and Perspectives, Disability Studies and Parenting Children with Disabilities. The authors Kelly and Gia. The argument is that there are no handbooks on how to parent a child with a disability. The many medical, educational, and social decisions that lay in the parent's hands can impact their child drastically. The source argues that understanding disability as a parent is difficult, and the use of proper resources can not only benefit the parents but also the child with a disability. The methodology is using mothers of children with disabilities who are also scholars of education and incorporating theory and reflecting on experiences of parenting a child with a disability. So some things that I pulled from that second secondary source. Parents are making life-altering medical, educational, and social decisions for their children. The responsibility of caring for a disabled child is heightened. Parents expressed how even though their children have different disabilities, they are equally as frustrated with medical and educational system interactions. Classrooms with non-disabled peers and segregated or self-contained classrooms with other children with disabilities. And despite years as school teachers and graduate degrees in curriculum with instruction and programmers that were focused on social justice, neither of us had much formal education about disability. In the poem, If the Mental Challenges Hadn't Been Seen as Such a Sin, I interpreted the word sin in a very negative connotation, representing the lack of inclusion and acceptance. When the poem is basically saying these mental challenges hadn't been seen as such a sin. Mental challenges can be seen as intellectual disability. In this article, it discusses how the classrooms are split, segregating disabled children from other non-disabled children. This idea that disability is a sin comes from stigmas and perceptions of society. I truly think by segregating those with disabilities and those without, you're teaching that there is something different about them. And yes, there might be something different about them, but segregating them puts that negative connotation on it. And we are teaching non-disabled children to have these preconceived stigmas or perceptions of disability. This makes it harder for inclusion and acceptance to happen when we continue to segregate the two. In the poem, they didn't ask for this, they came unprepared. This article was written by mothers of disabled children. It explains how even with extensive education, they weren't taught on how to handle or raise a child with a disability. Most parents who have a disabled child are desperate for guidance, as they feel that they did not choose to have a disabled child, or they aren't equipped with knowledge or financials to take care of one properly. I think it's important here to note that most parents don't have a child thinking that they're going to come out with a disability. So this unfamiliarity when they do have a child with a disability places them just at a huge risk for financial and psychological stressors because they are unfamiliar and uneducated on how to go about this kind of care. So when relating the source, I do believe that using the secondary source from the perspective of mothers who have raised a child with a disability helps us understand the poem. It shows that, oftentimes parents with a disabled child are often not prepared for the challenge. They have not received proper education regarding medical, social, or financial decisions which can impact the life of the child. The secondary source allows us to better understand how difficult it is to raise a child with a disability. Coming from authors who are school teachers that deal with children on a daily basis, have encountered disability from time to time in their practice, and hearing them discuss the different challenging components of raising a kid with a disability can also help us understand the perspective of the poem. Some negative social perceptions viewing disability as sinful, wrongful, or indifferent can actually place barriers in life for those with a disability. The source helps us understand that no parent expects for the child to be disabled, and most parents aren't properly equipped to care for someone with a disability. The poem says we need help from someone who has a clue. These authors are identifying the frameworks, theories, and their own experiences to show the need for disability scholar studies to help educate parents or individuals caring for disability. They also explain the importance of having a community that they can confide in, refer to, or get advice from to help them understand some of the similar things that they may be going through and how they can kind of maneuver through certain obstacles. It can also just help caregivers and families feel that they are not alone in these situations, which can also aid in psychological stressors and can also help them not feel alone in these positions. So I just want to end that this presentation. I learned a lot about disability and how it impacts more than the individual. Obviously, it is very easy when you go out and you see a disabled child to think, how does that impact their life? But I think that we overlook those that are caring for them and kind of the large mass amount of responsibility that is placed on them as well. Before doing this project, I knew that there was obviously a higher demand for financial payments for a child with a disability, but I don't think I understood how many caregivers had to stop working, had to cut hours just to care for the different components of their disabled child. I don't think I knew that there was limited access to private insurance, which made it more difficult to afford certain things. And being in the medical field, I obviously know about caregiver burden or nurse burden or burnout, whatever you want to call it, but I never applied the two when it came to caring for a disabled child. So I thought that that was really eye-opening. I do just want to bring up the fact that most parents do not go into having a child thinking the worst. Not saying that having a disabled child is the worst thing, but most parents expect to have a healthy baby. So when they aren't expecting the worst, they don't prepare for the worst. They don't prepare financially, they don't prepare emotionally, educationally, which puts them in a vulnerable spot because of the many decisions and judgments that they have